Have you ever experienced an irrational fear of something? A fear so strong, so overwhelming it seemed to consume your every thought and action? You may have experienced a phobia, an extreme or irrational fear of or aversion to something. Phobias are more than just a strong dislike. They cause significant distress and can disrupt a person's life. When we talk about phobias, they generally fall into three main categories. First, there are specific phobias. These fears focus on a particular object, situation, or activity. For example, you may have acrophobia, a fear of heights, or trypanophobia, a fear of receiving injections. Then there is social phobia, also known as social anxiety disorder. This involves an intense fear of social situations or of being scrutinized by others. It leads to avoidance of social interactions or performance situations. Finally, we have agoraphobia. This is a fear of situations where escape might be difficult or help might not be available. People with agoraphobia often avoid places or situations like crowded spaces, public transportation, or open spaces. So, why do phobias develop? They can arise due to a combination of genetic, environmental, and psychological factors. Traumatic experiences, learned behavior from family or observing others, or a predisposition to anxiety can all contribute to the development of phobias. Overcoming a phobia often involves facing the feared object or situation gradually and under the guidance of a mental health professional. There are several strategies that can help manage and overcome phobias. Exposure therapy, for instance, involves gradual and controlled exposure to the feared object or situation. This helps desensitize the fear response. Cognitive behavioral therapy, or CBT, helps to identify and challenge irrational thoughts and beliefs associated with the phobia. Relaxation techniques, such as deep breathing, mindfulness, or progressive muscle relaxation, can manage the anxiety associated with the phobia. In some cases, medication like anti-anxiety drugs or beta blockers might be prescribed to manage anxiety symptoms associated with phobias. Joining support groups and educating oneself about the phobia can also be beneficial. It provides understanding and practical advice from others who are going through similar experiences. Finally, self-help strategies, like learning stress management techniques, setting small achievable goals for exposure, and practicing self-compassion, can aid in managing phobias. The goal is not necessarily to completely eliminate the fear, but to learn ways to manage and cope with it effectively so it doesn't significantly impact one's life. In conclusion, phobias are intense, irrational fears that fall under three main categories: specific phobias, social phobia, and agoraphobia. They can develop due to a combination of factors and can be managed and overcome with a variety of strategies, including therapy, relaxation techniques, medication, support groups, and self-help strategies. Seeking professional help is recommended for a tailored approach to managing and overcoming phobias. Remember, it's okay to seek help. You're not alone in your journey.